Hi, I'm Jessica Mannion at My Healthcare Direct, and in today's video, I'm going to show you how you can look for prescription drug plans in your area. So the first thing you're going to want to do is go to Medicare.gov's website. Once you pull up their homepage, you're going to look for a blue box that says Find Health and Drug Plans and click on it. Now, this next page is going to ask you to log in or create an account, but you don't need to do that. So I suggest that you just click on Continue without logging in, which is listed just below that. Now it's going to ask you a couple of questions. The first one is, what exactly are you looking for? In this case, because we're just looking for a Part D drug plan, I'm going to select Drug Plan Part D. Then it's going to ask you for your zip code, so I'm going to go ahead and put a zip code in here and hit Continue. I'm just going to reconfirm that it's the correct county. That is correct. And then it's going to ask you if you get any help with your costs from one of these programs, whether it's Medicaid, Medicare Savings Program, extra help from Social Security. If you do get any help from those programs, you want to make sure you select it. Otherwise, if you're not sure, you can select I'm not sure, or if you know for a fact you don't get help with those programs, you can just select I don't get help from any of these programs and click Next. Now here is where it's going to ask you if you want to see what your drug costs would be and compare it with other plans. So if you're someone who's not taking any prescriptions currently, you can just select no to this question and keep moving forward. But in this case, I'm going to say that yes, I am taking some prescriptions so we can compare them with the different plan options. And then it's going to ask you how you get them filled. So do you get them at a pharmacy, or do you use mail order, or do you use both? In this case, I'm just going to go with retail pharmacy and click Next. So now here's where I'm going to actually put in my prescription. So I'm going to start typing in a prescription, and you can see here as I start to type that a drop down shows up below. With these prescriptions, there's many of them that have really funky spellings. So as long as you try to get in the ballpark of how you spell it, you can look for it in this drop down menu so you don't have to type the whole word. So I'm going to click lisinopril. You're going to click Add Drug. Now, if you click on this little drop down here, you can change the dosage of the prescription, and you'll want to make sure you have the correct quantity and how often you get it filled. So I'm going to say I take it once a day, so that's 30 for a month's supply. I'm going to add it to my list. And let's add one more. Let's see, we'll go with torvastatin, add drug. Let's change the dosage. Let's say this is the amount I get, add to drug list. And you can see that the list just grows the more and more prescriptions that you add to it. Once you're done putting in all of your prescriptions, you're going to click the green Done Adding Drugs button. And here's where you're going to actually pick the pharmacies that you want to see what the cost would be at those locations. So I'm just going to pick a couple popular ones. You can select up to 5. But I typically just select about 3 just to see. So once you're done picking your pharmacies, on the bottom right-hand side, you'll see a Done button. And now is where you finally pull up the prescription drug plans in your area. So it looks like in my county, there are 28 prescription drug plans available. So before I go ahead and I start comparing the plans and looking at them, there's a couple of different things you can do. The first thing you can do is you can sort the plans. And there's 3 different options that you have. So if you look over here on the right, you'll see a tab that says Sort Plans By, and if you click on the drop-down menu, you can select lowest yearly drug deductible, the lowest drug and premium cost, or the lowest monthly premium. I typically like to keep it on the lowest drug and premium cost, so I'm going to leave it the way it is. But if you were someone that just wanted to see which one had the lowest drug deductible or the one that had just the lowest monthly premium, you can sort it that way as well. And then as you scroll down, you can see a list of all the different types of prescription drug plans that are available. So the first thing you look at, you'll see is the name of the plan itself. You'll see its star rating, which this plan has a 3.5 out of 5 stars. You'll see what the monthly premium is, the yearly drug and premium cost, which is estimated based on what prescriptions you put in, and as well as a drug deductible, if there is one on that plan. So the first thing I'm going to do is I'm just going to click 1 just to look at the plan details, and then I can show you how to compare multiple drug plans side by side. So let's just take a look at this SilverScript plan. So if you wanted to get more detailed information, you're going to look for the blue box that says Plan Details. So if we click on this plan, you'll see that the monthly premium is only $7.30 a month. it does have a drug deductible of $445. Now, for most prescription drug plans, that drug deductible only comes into play when you have a tier 3 drug or higher. Now, that's in most situations. In some drug plans, it can't even affect tier 2 drugs, but in most prescription drug plans, it's tier 3 and higher drugs where you'd have to meet that deductible first. So let's look at some of the drug coverage and costs. So this is where it breaks down the estimated cost based off of what tier level your prescription would be labeled at. So if it's a preferred generic at a preferred retail pharmacy for a 1-month supply, it would be a $0 copay. If it was just a generic, it would be $19. Preferred brand, which is usually a tier 3, would be $46. And then a tier 4 and tier 5 would be a co-insurance or a percentage. If you went to a standard retail pharmacy, it would be a little bit more expensive. So there is a difference when it comes to a preferred retail pharmacy and a standard retail pharmacy. So a preferred in-network retail pharmacy means that you're going to get that prescription at a much better rate than if you went to a standard network pharmacy, which you can see right here. A tier 1 would be $19 at a standard pharmacy versus costing you nothing at a preferred pharmacy. So that is something you want to take into consideration when you're looking at drug plans. Okay, so the next is the pharmacies that I selected. So I had selected Walgreens, Publix, and CVS. On this particular plan, Walgreens is an out-of-network pharmacy. So if I signed up with this plan, I wouldn't want to use Walgreens to get any of my prescriptions. However, Publix and CVS are both preferred in-network pharmacies. So if I go to those locations, I'm going to get the best possible price for my prescriptions than if I went to a place like Walgreens. So this tells me if I'm interested in signing up in this plan, these are the pharmacy locations I should be looking at when I'm getting my prescriptions filled. So now we're going to look at the actual estimated costs of the drugs at those pharmacies. So if I scroll down here and I see Walgreens, because it's out of network, you can see how the cost under the cost before deductible column is very high. Now, I know for a fact that atorvastatin and lisinopril are pretty generic drugs, so to be paying that much for a prescription shouldn't be necessary. So I know Walgreens is out. I'm not going to consider Walgreens. But let's go to Publix here. So if you look at the cost before deductible column, you'll see that both prescriptions aren't going to cost me anything if I go to that pharmacy. So because of that, I can also see my breakdown of costs on a monthly basis for my prescriptions. Because they are both generic prescriptions that aren't going to cost me anything, I'm not going to be paying anything monthly to get them filled. The only thing I would be spending would be the premium for the drug plan itself, which is why you'll see here where it says you will pay $65.70 per year on your drug and premium costs. Because I don't have any drug costs, because both my prescriptions are free, that is basically taking the premium of the drug plan and multiplying it out by however many months you need it. So very affordable if I go to Publix, and it looks like the same thing with CVS. So if I go to either of those pharmacies, I'm going to get the best deal possible for my prescriptions. And then the last thing I want to show you is that below the pharmacies and the costs at each pharmacy, you'll see under other drug information, the drugs that I had put in that are listed, it'll tell you what tier level it is designated on that drug plan. So on this SilverScript plan, both of the prescriptions I'm taking are tier 1 prescriptions. So if they're tier 1, if we scroll back up to where it broke down the costs, because Publix and CVS were preferred in-network pharmacies, it would cost me $0. So that's just another way of double checking to make sure everything's adding up. And in this case, it is. Now, let's say you want to compare a couple of drug plans. You looked at this one. This sounds great, but I want to see some other options. If you scroll up to the top and click this button that says back to search results, you'll go back to the page where all of the drug plans are listed. Now, if you want to select a couple to compare, there's only 3 at a time that you can select, but you're going to look for the button that is next to the plan details box that says add to compare. And you're going to click that box. And let's say I'll click this one. And let's say I'll click this one. So once you've selected 3, you're going to hit compare, and you can see the plans side by side. Now, when you see the plans side by side, they're not going to give you as much detailed information as when you're looking at one plan at a time. So it'll give you some basic information, but it won't give you as much detailed information like the cost of the prescriptions on that plan unless you click on that plan's details. So on these 3 plans, you can see the prices, how they compare, the drug deductible, which in this case is all the same. And then you can see which pharmacies are standard, out-of-network, or preferred in-network pharmacies. So on this WellCare plan in the middle, you can see that Walgreens is a standard in-network, but Publix and CVS, is preferred, and CVS is also standard. So if you look at the costs of the prescriptions over time, you can see how Publix is a lot cheaper than both CVS and Walgreens. That's because it's preferred in-network. And the same thing with this ClearSpring Health Premier Drug Plan. If you scroll down to the pharmacies, you'll see that Walgreens and Publix are the standard pharmacies, and in this case, CVS is the preferred pharmacy, meaning you're going to pay a lot less if you go to CVS than if you go to Publix or Walgreens on this plan. So if I click on plan details again, and you scroll down, you can see how the costs are broken down on the plan regardless of the drug. You can see which ones are preferred versus standard. And then you can see at that pharmacy what your estimated costs are going to be, whether it's on a monthly basis or before you meet any type of deductible. And you can see how the prices change depending upon the pharmacy that you go to. So clearly CVS is the winner here because it's only going to cost me $2 versus $20 from either of the other pharmacies. And then finally, I always like to scroll down. They're both still considered a tier 1 on this drug plan. Now, that's something else that's really important to note is that what might be a tier 1 on one type of drug plan with one carrier might be different on another. So a atorvastatin, for example, could be a tier 2 on another plan. Therefore, the cost might be different. So you always want to just kind of double check and make sure that that's adding up as well. But ultimately, the biggest thing you want to pay attention to is your estimated costs when you go to that specific pharmacy that you're interested in looking at. So that's pretty much it in a nutshell, how you can find drug plans. And if you found one that you really like and you want to go ahead and enroll, there is a green enroll button that you can select, and you can join the plan and fill out your information and enroll yourself in your own prescription drug plan. So if you have any other questions on prescription drug plans, feel free to give our office a call at 888-959-1028. You can also check out our website at www.myhealthcaredirect.com, and you can also like us on Facebook.